Many women are never told how their bodies change after menopause, especially when it comes to intimacy and self-pleasure. What used to feel natural in earlier years can suddenly feel different, and these changes sometimes create confusion, discomfort, or even silent worry. After the age of 50, hormone levels shift, the skin and tissues of the body become more delicate, and moisture decreases. These natural changes also affect the pelvic area, including the vagina. That is why self-pleasure is no longer just a private habit, it becomes a meaningful part of personal health and emotional well-being. Many women do not realize that masturbation can support or harm the vagina depending on how it is done. It can either improve circulation, elasticity, and comfort, or it can quietly create irritation, dryness, and pain if done without proper understanding. Self-pleasure affects more than pleasure alone. It influences blood flow, pelvic floor muscle strength, tissue health, emotional balance, and even bladder function. These are not ideas or opinions, they are biological facts that have been proven through research. Women often enter menopause without receiving education about their changing bodies. As a result, they assume discomfort or loss of desire is simply part of aging. But that is not true. The body still responds to touch, and intimacy still matters at every age. What changes is not your need for pleasure, but the way your body experiences it. Self-pleasure can be healing, and in many cases, it supports overall health. For years, many women avoided talking openly about intimacy because they were raised to believe it should be private, or that female pleasure was not important. After menopause, that silence becomes heavier. Women often hesitate to ask questions about their changing bodies, even when they feel concerned. But avoiding this topic does not solve anything. In fact, staying silent can lead to more physical discomfort, infections, and emotional disconnection from one's own body. Talking about self-pleasure after menopause is not inappropriate. It is necessary because it is closely connected to physical wellness, emotional balance, and confidence. When a woman stops being intimate, either with a partner or with herself, the tissues in the vagina gradually lose flexibility. Blood flow decreases, and over time, this can lead to a condition called vaginal atrophy. The vagina becomes dry, tight, and fragile. This can cause pain not only during intimacy but even while sitting or walking. Without regular stimulation, the pelvic floor muscles also weaken, increasing the risk of urinary leakage and prolapse. Many women experience recurrent urinary tract infections because the natural protective bacteria decrease due to lack of blood flow and lubrication. These problems are common, but they are not irreversible. With gentle, regular stimulation, many women can regain vaginal comfort, improve moisture, and increase sexual sensitivity again, even after years of dryness or pain. Biologically, the benefits of arousal are powerful. When a woman becomes aroused, blood vessels in the pelvic area widen, allowing fresh oxygen and nutrients to reach the tissues. This keeps the vagina flexible and healthy. Orgasm also causes rhythmic contractions that strengthen the pelvic floor. Strong pelvic muscles provide better bladder control and support for reproductive organs. Regular stimulation can even help balance hormones such as oxytocin and dopamine, which reduce stress and improve mood. That is why many women report better sleep and increased emotional calm after self-pleasure. It is important to understand that a changing body does not mean a failing body. It simply needs a new kind of care. What worked at age May 25 not be suitable after 50, and that is natural. The body adapts, and so should personal habits. Self-pleasure is not only safe for women over 50, it is recommended when done with awareness and care. However, it can become harmful if done incorrectly. Many women unknowingly make mistakes that cause irritation, discomfort, or numbness over time. One common mistake is using no lubrication. After menopause, the body does not produce as much natural moisture, so dry friction can cause micro-tears in the tissue. This leads to soreness, burning sensations, and infections. Another mistake is using products like lotions, oils, or soaps that are not designed for the vagina. These disrupt the natural pH balance, causing itching, inflammation, or bacterial issues. Some women rely only on strong vibrators and intense stimulation, which can desensitize the clitoral nerves over time. Others rush the process and skip arousal, putting pressure on fragile tissues that need slow warming to stay healthy. These habits do not bring true pleasure, they can actually cause long-term harm. Pain during self-pleasure or intimacy is not normal, and ignoring it only makes things worse. Instead, women should learn gentle methods that support their bodies. Self-pleasure should not carry shame or guilt. It is a natural part of self-care and healthy aging. Women do not lose their desire for closeness or intimacy after menopause. In most cases, they simply need new knowledge and reassurance to connect with their bodies again. This is about confidence, health, and emotional well-being. Many women who felt disconnected from their bodies regained vitality when they allowed themselves to explore without judgment. Their goal was not just sexual satisfaction, it was self-acceptance and comfort in their own skin. Understanding the body and treating it with respect creates empowerment. When women let go of shame and listen to what their bodies need, intimacy becomes positive instead of confusing. Knowledge replaces fear. Self-care replaces silence. This is not about age. This is about taking control of your health and pleasure in a gentle, natural way. While self-pleasure offers many physical and emotional benefits after menopause, it must be practiced with awareness to avoid unnecessary harm. Many women unintentionally adopt habits that cause irritation, soreness, or reduced sensation over time. These issues are not caused by the act itself but by the way it is done. One of the most common mistakes is ignoring the need for proper lubrication. After menopause, natural moisture decreases due to lower estrogen levels. This means friction without lubrication can damage delicate tissues. The vagina becomes more sensitive to dryness, and any harsh movement or pressure may cause microscopic tears. These tiny injuries can lead to burning, itching, or even recurring urinary infections. Using lubrication should be seen not as a sign of weakness, but as a form of care and protection. Choosing a gentle water-based or silicone-based lubricant can make a significant difference in comfort and safety. Another frequent mistake is using products not designed for intimate areas. Soaps, body lotions, cooking oils, and scented products can disturb the natural protective balance of the vaginal area. These products often contain chemicals, fragrances, or preservatives that irritate sensitive tissues. Even some household oils may trap bacteria and increase the risk of infections. The safest choice is to use products made specifically for intimacy and approved for vaginal use. The skin in this area has a unique pH level, and disrupting it can create itching, inflammation, and discomfort that lasts long after the moment is over. Proper hygiene before and after self-pleasure is important, but it should always be done gently with warm water and mild, fragrance-free products. Some women also fall into the habit of rushing. They may feel guilty taking time for themselves, or they may simply want a quick release. However, rushing prevents the body from naturally preparing for pleasure. Arousal is not just a feeling, it is a biological process. When arousal builds slowly, blood flow increases, tissues swell gently, and natural lubrication begins to form, even if only in small amounts after menopause. Skipping this warming phase can make the experience uncomfortable rather than enjoyable. It is healthier to explore gradually with light touch before applying more direct stimulation. This allows the body to respond more fully and reduces the chance of pain or soreness. Another issue many women are unaware of is the overuse of strong vibrators. While vibrators can be helpful tools for stimulation, very powerful ones can cause the nerves around the clitoris to become overstimulated. Over time, this can reduce natural sensitivity, making it harder to feel pleasure without strong stimulation. This does not mean vibrators are harmful, but it does mean that moderation is important. Alternating between hands and gentle devices, and avoiding excessive pressure, keeps the nerves responsive and healthy. Ignoring pain is another common mistake. Many women believe some level of pain is normal after menopause because their bodies have changed. But pain is not something to ignore, it is a message from the body. If something feels uncomfortable, it should not be dismissed. Adjusting technique, adding lubrication, slowing down, or trying a different approach can prevent long-term irritation. If pain continues, it may be a sign of an underlying condition like vaginal atrophy, pelvic tension, or infection, and a healthcare professional should be consulted. Good sexual health includes listening to the body, not forcing it. Practicing self-pleasure safely after 50 involves a few simple habits that support long-term vaginal health. Using lubrication regularly protects the tissues and makes touch more comfortable. Warming the body with slow, relaxed movements increases natural moisture and protection. Being gentle allows sensation to grow rather than forcing it. Exploring different areas of the body, not just the most sensitive ones, can awaken new forms of pleasure. The outer labia, inner thighs, breasts, and lower abdomen can all contribute to arousal when touched slowly and calmly. Breathing deeply also helps the body relax and increases blood flow. Afterward, cleaning gently with warm water helps prevent irritation without removing the body's natural protective oils. Self-pleasure should be seen as an act of care, not secrecy. It is a way to maintain pelvic health, emotional balance, and body confidence. When a woman reconnects with her body, she begins to feel more grounded and alive. This connection improves not only physical comfort but emotional wellness. Many women describe a renewed sense of closeness with themselves. They no longer feel disconnected or unfamiliar with their bodies. Instead, they feel proud of their ability to nurture their health naturally. This emotional shift builds confidence and reduces the feelings of aging that often appear during and after menopause. Age does not limit a woman's capacity for pleasure or intimacy. What changes is the approach. Self-pleasure after 50 becomes more intentional. It becomes part of self-care, just like exercise, sleep, or healthy eating. It is not something to feel embarrassed about. It supports blood flow, strengthens muscles, reduces stress, and promotes better sleep. These are real health benefits that make daily life more comfortable. Women who take time to care for their intimate health often feel more energetic, more relaxed, and more connected to who they are. Intimacy is not only about the body. It is also about identity. Touch reminds a woman that she is still whole, still feminine, and still capable of joy. Menopause may change the body, but it does not end the human need for connection. Embracing self-pleasure is a personal choice that brings healing and empowerment. It sends a message that pleasure is not reserved for youth. It belongs to anyone who chooses to value their well-being. By removing shame and embracing natural curiosity, women can experience renewed vitality at any age. The key is to listen to the body, move with patience, and allow pleasure to unfold without pressure. With simple awareness and care, self-pleasure becomes a health practice that nourishes both body and spirit, bringing comfort, strength, and personal freedom.